Hi, welcome back. The brain, mind, and body, and the healing of trauma. So when we experience a traumatic event, the sensation that comes in through the senses and enters the brain hits a little part of the brain called the thalamus, shoots to the amygdala, a lower brain structure, and also goes up a higher brain area called the prefrontal cortex. And hormones are released that send off alarm bells all through our system and tell us that we need to do something because there's danger near. And that message goes out before we even necessarily are consciously aware of what's going on. In the event that this is a very traumatic thing that's happening, or we're chronically in an abusive situation, or we're a prisoner of war and we're unable to escape from the trauma, we may become so overwhelmed that the prefrontal cortex shuts down and those alarm bells continue to go off over and over and over again. In a situation like that, the sensations that we experience can actually become trapped and become a flashback and can become triggered again whenever we see something or hear something or feel something that reminds us of the original trauma. I explain this in more detail in the video that's the first part of this series. Traumatic memories and normal memories are not the same thing. Normal memories occur in a narrative. So we'll think back to something that happened, say something good, a graduation, a birthday party, the birth of a child, and we remember it as a story. And we remember it often in a linear way, and we can tell it as a narrative. Often that narrative changes over time. Every time we remember it, every time we retell it, there may be new details. It may be different. We add to it, we subtract to it. We know, and research supports this, that memories are flexible. They're really not stable, and they're really not really reliable or consistent, but they are a narrative. Traumatic memory is fragmented. It occurs in bits, pieces, flashes, and it's not a story. It can't always be retold in words. Traumatic memory is feelings. Normal memory is words. Traumatic memory is disorganized, whereas normal memory feels very organized. This next part is probably the most important difference, and that is that traumatic memory feels very much like it's present, it's happening right now, whereas normal memory feels as if it's in the past. We know it's in the past. A traumatic memory, when triggered, particularly in the form of a flashback, feels like it's happening right now. The body's memory is triggered, and I am right back there in the middle of the trauma again. This is what's known as a dual memory system. And the presence of those traumatic memories in our system, in our body, is treated by our body like a foreign entity, like a splinter. It can result in illness, autoimmune illnesses, and other problems. And over time, it creates ongoing difficulties and problems for people. Extreme examples of the presence of traumatic memories are repressed memories, dissociative states, dissociative identity disorder, complex PTSD, and chronic severe self-injury and chronic suicidal ideation and suicide attempts. All of these things can occur because of the presence of this abnormal memory state. What are the therapies for trauma like this? There are different ways to approach therapy for people who've experienced trauma, and several authors and scientists have sort of broken this down into sort of top down and bottom up. Top down is like talking therapy, so we're thinking about it like we're going to use the more analytical parts of the brain to analyze, to look at, to understand where the symptoms are coming from. Why? So there are several reasons why top-down therapy doesn't work very well, or at least does not guarantee the mitigation of traumatic symptoms. First of all, trauma is not stored as a narrative. like I said a minute ago. So helping people to talk through or process with words their trauma doesn't necessarily really reach in and get at those fragmented and non-narrative memories. Talking encourages narrative recall, which sometimes people are not capable of doing. Telling a story is really important, but to really unfreeze those traumatic memories and to get at those really caught feelings, we have to go at it from another angle. So what we really need to do is we need to integrate the prefrontal cortex with the lower brain function in order to heal. In other words, what's happened is that prefrontal cortex has kind of been gone offline, right? It's kind of disconnected and allowed that lower brain function to kind of take over and continue to send off those alarm bells kind of willy-nilly. And without the connection being reinstalled, we don't really have any hope of having kind of leadership take back over and settle things back down. There's a whole bunch of therapies now called bottom up, which is really working from the body up, and those seem to be somewhat more effective. On the body first, understanding that the trauma itself is stored within the body, not really in the brain. So we have to accept and do what's called befriend those feelings rather than trying to kind of run away from them. The natural thing for all of us to do is when we have uncomfortable, scary, even terrifying feelings and body responses, pounding heart, sweaty palms, shortness of breath, is we want to stop them. We want to avoid them. So rather than reaching in and embracing those traumatic memories which are stored in the body, I'm going to avoid them, encapsulate them. And so they're going to just kind of stay there and continue to create all sorts of problems. An approach known as limbic system therapy, which is sort of a catch-all, seems to work better. What does limbic system therapy mean? Well, if you watched my other video, you know that the limbic system is sort of the emotional brain. It's not the prefrontal cortex, which is our analytical brain, our thinking brain. It's lower part of the brain. It's where the thalamus sits. And it's the part of the brain that when these sensations come in the event, in all sorts of events, but particularly in the event of trauma or an emergency, sensations come in. It's the part of the brain responsible for determining what is dangerous, what is scary, what is pleasurable, what is good. And if we've had trauma, then that part of the brain is often kind of in charge. It's kind of sending off scary signals all over the place without regulation from the prefrontal cortex. And what needs to happen in order for us to feel better is that a balance needs to be restored. Because what's happening is the limbic system, every time it's triggered, the survivor of trauma is pushed either into panic or into kind of a numbing state. And that executive function, that higher order function, is shut down. That leadership is lost. Let's talk about what sorts of therapeutic interventions really work. When we talk about bottom up, we talk about managing our body first. So breath. So one of the things that happens in hyperarousal or agitation and panic when recalling traumatic memories or during a flashback is shortness of breath or rapid breathing. Breath is one of the things we can voluntarily control, as opposed to a rapid heartbeat or sweaty palms or some of the other things. So learning how to breathe slowly in for 3 counts, slowly out for 3 counts, particularly pausing at the end of the exhale before taking another inhale. Doing that several times can actually force a slowing down of the nervous system and force the body out of a state of hyperarousal. In addition to that, focusing on breath forces the brain to let go of some of the panicky thoughts, which can be helpful. So learning how to breathe and learning how to focus on breath, particularly while recalling some of the traumatic memories, is an essential tool. And it can be practiced obviously alone and can also be practiced in the presence of a therapist while working on some of these memories. Breath is something used in almost everything: group therapy, individual therapy, yoga, massage, all kinds of things. So it is number one and a totally essential tool. Mindfulness, also something taught in many of the different kinds of therapy with trauma survivors. And mindfulness basically is what it sounds like it is: focusing on where you are right now, where your body is in space, and sort of letting go of everything else, the future, the past. And it takes some practice, but it is an incredibly powerful tool. Mindfulness is important for several reasons. Learning how to focus on the here and now, knowing where our body is in space, allowing our brains to focus on both feelings, emotions, and physical sensations. Learning how to tolerate what is now is really critical, because most traumatized people have a tremendous fear of feeling. The worry is that once feelings are allowed in, we might be sort of hijacked by those emotions, which will kind of run away and create this panic situation. So learning how to recognize and tolerate what the body is experiencing, what the mind is experiencing now, and understand that physical sensations are transient and emotions are transient. So whatever I'm feeling right now in my body, whether it's pain in my chest or an ache in my shoulder or an ache in my stomach, whether I'm feeling a depressed feeling in my brain, whatever it is transient. There's also a connection between my body sensations and my feelings, my emotions, often related to movement and breath. I can take a deep breath and sometimes change the physical sensation in my body. And learning how to focus on exactly what is happening right now and how those things are connected and how they change helps to have a better understanding of our bodies and brains, our minds, our emotional state, and be less fearful of what can come next. Mindfulness research has shown that learning mindfulness techniques has the power to improve our emotional state and our physical state. It is effective in treating depression, pain, chronic pain, immune disorders, and also has a positive impact on blood pressure and cortisol levels. So it is a very powerful tool. There are also several types of somatic therapies, somatic meaning body. An example might be sensorimotor psychotherapy or somatic experiencing. These are somewhat complex and I won't go into detail, but for example, in sensory motor psychotherapy, which has been around for a long time and is used with children and trauma survivors, the therapist would use a combination of talk therapy and work with the body to help the person work through the trauma. For example, if the person is talking about witnessing a traumatic event, the therapist might ask the patient to talk about how they were feeling up to the event, and then talk about where in their body, in their physical body, they're feeling it. Do they have pain in their stomach or darkness in their chest, or is there some physical place in their body that they're feeling it? The therapist might then walk the patient through the event and help them to physically work through what they might have wanted to do, action-wise, what they might have wanted to do during the event that perhaps they were not able to do, and thereby physically, not just with words, process the trauma. That's a very brief, somewhat simplified example, but these therapies are highly specialized depending on the needs of the patient. The point is that they utilize both words and the physical body in order to work through the trauma. The presence of strong relationships, and if not the presence, then the development of those relationships is critical. These can be friends, loved ones, therapists, doctors, others. But it is really important when a person has survived trauma to encourage the development of a social network that is strong and trusted and supported. It is not unusual for a survivor of trauma to feel they trust no one. And this is a difficult starting point, but not impossible. Traumatized people recover best in the context of relationships. There's a lot of research following wars, situations in which people are separated from loved ones, that those who are reunited as quickly as possible do the best by far. Because we are wired as social beings and because we are dependent on these relationships, trauma that has occurred within the context of these relationships is the most difficult to recover from. It tends to be more difficult than recovery from traffic accidents and other sorts of traumatic events. Thus, children who have been abused at the hands of their parents, people who have been assaulted or attacked, abused at the hands of domestic partners tend to be more symptomatic and more difficult. If you are someone who has been betrayed by loved ones, you are far more likely to be distrustful of almost everyone and decide that it's best to handle all of your traumatic symptoms on your own. Also, research shows that people with this sort of trauma and betrayal are far less likely to connect their current symptoms and current difficulties with the history of abuse and trauma that they suffered, and therefore simply feel that life is unmanageable or that they are fundamentally damaged somehow and that it's all their fault. They won't seek treatment and have difficulty sort of connecting the past with the present. Unfortunately, trying to manage the fallout of this kind of trauma on your own results in a whole nother set of problems: isolation, severe depression, suicidality, addiction, and terrible despair. Relief and peace come with acknowledgement that there's a connection and that we need help. Unfortunately, unresolved trauma often leaves people with a sense of shame and guilt and a terrible fear of rejection. The sense is that if I were to approach you, if I were to let you know who I am, I would be rejected. You would find out who I am and you would run away from me. And so it's this vicious cycle of, even if I do recognize I need help, I don't really want to ask for it because that would be worse than being alone. All of this poses a very, very difficult problem for recovery. One of the best ways to overcome the hurdle of all of these hurdles that are presented is to recognize that all of this started out with your brain trying to protect you and save your life. So in other words, all of these alarm bells that are going off in your brain are your brain's attempt to take care of you. When you were faced with a trauma, particularly if this happened in childhood, your limbic system sent off alarm bells saying, run away or do something or take care of yourself. And when you're a child in particular, or when you are the victim of domestic abuse and you're trapped, you can't really do anything and you're stuck. And so those alarm bells keep going off and you're not able to do anything or go anywhere. And so that system, which is built in to protect you, kind of goes haywire and leaves you with this alarm cycle going off that isn't very helpful anymore. So all of this started with your normal brain trying to take care of you. It's not your fault. And if we can kind of remember that, then sometimes seeking help makes more sense. When a person has been hurt and betrayed this badly, it often helps to just find one person, one therapist, one friend, one counselor, one person who we can sort of stick a toe in the water with, and if not trust, at least feel like we might be able to want to trust to get started. Additional body work that can also be very beneficial, particularly when it comes to trust, is massage therapy, other types of body work, again, sensory integration. Those types of body work, particularly when done with therapists that have lots of experience working with people who are survivors of trauma, can go a long way in building trust. Yoga has been particularly helpful in treating trauma. There are specific yoga classes for trauma, but lots of kinds of yoga are helpful, probably mostly because they focus on mindfulness and breath. And again, it's a reinforcement of those tools. Writing. Why is writing helpful? Writing helps us to access the inner feelings that we have. There's a particular type of writing called free writing or stream of consciousness writing, where we sort of write down the very first thing that comes to mind and then the next thing after that and the next thing after that. There's actually been research done on that type of writing, and what has been found is that it can reduce illness, improve immune function, physical and mental health, and is very effective at accessing some of those more fragmented memories. I encourage anyone who hasn't tried it to try it. You can dump the stuff you write afterwards, but many people find it helpful to show it to a therapist if you have one, or reread it and see what comes up. EMDR, which stands for eye movement desensitization and reprocessing, can be a very effective treatment. It is complex and in-depth, and I'm going to devote an entire video to it, so I won't go into it in detail here. EMDR is based on the idea that a person cannot simultaneously experience maximum emotional intensity while also performing bilateral tasks. So the idea is that you're focusing on two things at one time and also focusing on the trauma, and that sort of reduces the emotional intensity. Again, I will do a video focused on EMDR exclusively and discuss it in more detail. It should be noted that it has been the focus of a lot of controversy, and there is no professional agreement about its efficacy or safety. But there are a lot of people who believe that it is an effective treatment for a lot of patients who've suffered trauma. And that's why I include it in this video. Proponents of EMDR treatment believe that something about the EMDR technique seems to allow people to actually heal from trauma without directly talking about it. It somehow seems to loosen up something in the mind-brain and more rapidly allow access for some people. And it is particularly helpful, or it may be particularly helpful, when there's a less trusting relationship. Not because the therapist is not trustworthy, but perhaps the traumatized person has more significant issues with trust, or they've just met, or something like that. Dialectical behavioral therapy is another form of therapy that is based on mindfulness, and I will go into that also in more detail in another video, but should also be noted. I want to just briefly touch on a couple of things that are less helpful, or at least based on the research currently appear to be less helpful in people who've experienced significant trauma. And those are cognitive behavioral therapy, although we do use it and it depends on the specific patient. Cognitive behavioral therapy and desensitization appear to be somewhat less helpful in severely traumatized patients. And as I noted at the beginning, traditional talk therapy, although I think supportive talk therapy is always helpful, and I want to make it really clear that talking in general is still helpful. I do believe in that. But traditional talk therapy does not guarantee a mitigation or a decrease of the traumatic symptoms. Finally, I want to talk about hypnosis. Although hypnosis has been less in style recently, there is a lot of historical research and a fair amount of support by trauma therapists for the use of hypnosis in relaxing the mind and the body to the point where the person who has been traumatized can tolerate talking about the trauma without triggering the traumatic response. And there is a tremendous benefit to that. Again, going back to the idea that what we want to do is integrate the prefrontal cortex with the limbic system again and sort of put the boss, which is the prefrontal cortex, back in charge. The idea is that if we can settle things down enough, we can sort of keep the prefrontal cortex back online. We can keep it online while we're remembering the feelings that we were having during the traumatic event or during the traumatic events. So this allows potentially an expedited integration of the traumatic memories. The idea is that we can then put those memories into the past. When we have those memories coming up in fragments and bits as these emotional triggers that are sort of going all over the place, then they feel like they belong to the present. If every time I see a trigger or hear a trigger or smell a trigger, I'm re-experiencing the event, it belongs in the present. It suddenly becomes part of my present life. And I have this blurring of past and present. What we want to do is be able to put those memories, that trauma, where it belongs, which is in my past. And for that, I need the connection to the prefrontal cortex. So hypnosis can be a useful tool in making that happen. It needs to be hypnosis done by a therapist who is experienced in working, obviously doing hypnosis, but working with people who have been traumatized. Medications. There are several different medications that are used, probably over years. All the medications have been used to treat trauma, PTSD, various sequelae of trauma. Currently, most commonly, the SSRIs are used to mitigate many of the symptoms of trauma, and I do think they can be effective, but I don't think they, on their own, are the complete treatment. In addition to that, some psychiatrists will use the benzodiazepines, although those need to be used very carefully because they are addictive and can be very dangerous, certainly in overdose, particularly when combined with alcohol or other substances. Some people use the beta blockers, medications like propranolol, which can decrease some of the symptoms of rapid heartbeat, some of the things that occur with a fight or flight response, and those can also be helpful. But again, it's important to note that none of the medications available can successfully treat all of the symptoms of trauma and certainly do not integrate the prefrontal cortex and the limbic system, as I've noted several times in this video, and which I think is really the key to regaining our full function. So that's a rundown of some of the basic treatment approaches to trauma and severe trauma. I'm going to put up a slide here that has a list of them. This is by no means all-inclusive. There are many, many ways to approach a patient who has been traumatized. And I think some of the best trauma therapists use all sorts of techniques based on what is most effective for a given patient, a given person who has been through trauma. It's really dependent upon the person. We need to base our treatment approach on the individual. And so a really good trauma therapist should be fairly flexible and certainly well skilled in more than one, more than two, several different types of trauma therapy. Probably not all of them, but certainly several. So that's it for today. The brain, the mind, and the body, how they're connected, and the healing of trauma. Thanks for listening. As I said, I'll do 2 more videos on the specifics of EMDR and DBT because they are complicated. Please see the links below. If you're interested in part 1 of this 2-part series, please see the link below. And don't forget to subscribe and hit the notification bell so you don't miss anything. Again, thanks for listening, and I'll see you next time.